Okay, so in this video, if you didn't see the first one, first video I was talking a little bit more about COVID prevention. What happens if it fails? And so now you have to take care of someone that takes COVID. First of all, it could be yourself or somebody else. And like I mentioned, the other video, first of all, having a COVID positive or knowing that you have COVID doesn't mean it's um, a death sentence. Like sometimes it seems to be um, said in the medias and online. There's about so let's say you would have right now the numbers can change, but as it goes right now, out of about let's say you have 100 people that are positive for COVID, 80% will have mild to moderate symptoms. So that means that they can go home, they will recuperate, and they just need to monitor themselves, wait for the symptoms to go away, that 14 to 15 days, and they'll do fine, and they just have to stay put and take care of themselves, monitor themselves to see that they don't get worse, and then they'll do fine. So that's about 80 to 90% of the people that are taken care of. The other 20%, a good some portion of that. So I think it's around 15%, 10 to 15% of that 20%. So about half of that 20% will be admitted on the regular wards. So just all they need is a little bit of oxygen, some antibiotics, and maybe some fluid, and they'll need a monitoring, but they don't need intensive care. The other 5%, 5 to 10% will need an ICU bed, but that doesn't mean also they will have to have a tube in their mouth. It's just that a lot of the ICU has been repurposed, and they have a special room which has a better ventilation. And recently I've worked, so yes, I did work in an ICU that had COVID patient. My patient was one that was not intubated, so he was in the category of the 5% that was too sick to be on the wards, but not sick enough to have a tube in their mouth. And all he was on kind of special oxygen delivery, but they're come in and out of it, and so they require a little bit more care. They can drop down pretty quickly, so we have to be there in case that happened, because there's a whole procedure to do if we need to put a tube in. So there's those people, and sometimes they do well and they get out. And then there's another portion, again about 3%, that do need an intubation. Those people are very, very sick. They have what we call ARDS, acute respiratory distress syndrome, or adult respiratory distress syndrome. The name keeps changing. But basically it means like their lungs are not compliant, so they take off a lot of fluids, and they're very hard to ventilate it. They also require a lot of support on the kidneys on a machine that we call continuous renal replacement therapy, or CRT. And they're very sick people. So that portion of people, they're the ones who also even sometimes needs another machine higher up than that, which is called ECMO, which is basically a bypass machine. So all your oxygenation and your blood is taken over into a machine and kind of reintroduced to yourself to clean it all up and stuff. So some of those patients require that, and the mortality remains around 1 to 2%. So again, the positive, so even if you're positive, a lot of those people will stay home. Another portion will go on the wards, need maybe a little bit of supervision, but still will do well. And another portion may be the ICU, but they may get out of that. So it's not a death sentence. So first of all, if you test positive and your symptoms are in the mild category, don't be too fatty. But based on what has been seen, a lot of people around the 9-day mark kind of take 2 pads. So everybody will start having symptoms. Usually it's about a 14-day kind of incubation or like disease process. And around the day 5, you start having symptoms. So those are the ones that's going to come in emergency, that have trouble breathing, runny nose, and all that stuff, and fever. And they're the ones going to be tested by the swabs. And then around the day, so there's about 4 days that you'll monitor them. And around the day 9, that's when they start deteriorating or feeling bad and kind of taking a turn for the worse, and kind of goes into what we were talking about. The other 20% are they going to be in the 15 that kind of do well, or the 5% that will need more support, and maybe the 2% that won't make it out. Added to this is that if you have any comorbidity, heart disease, asthma, all those things, they put you more at risk. To remember, to go back on the prevention a little bit, is that a lot of people think, well, I'm healthy, so I can go out and everything. So it's not so much about you to protect yourself, but it's to not give it to other people. So you could have the symptoms that are very, very mild, but you could transmit it. So the reason that we self-isolate ourselves is so that we don't transmit it to somebody else, more grandma or grandpa or somebody that has immunocompromised issue. So it's more to protect everybody and then to protect ourselves. I don't think I would, based on my age and my health and everything, that would be in the category that would do poorly. But one of the reasons that I try not to visit anybody that could be highly suspicious is that you don't want to be that person that gives it to someone else. So now you have it. So what do you do? So when you go home, one good thing to do, it depends on your living space. If you can, if anybody saw the Urban Prepper video, having one of those rooms that you can separate yourself would be the perfect thing. Try to have your own separate room. If you live right now in the place I am, we have 2 different rooms. There's a guest room and a regular room. Live in the guest room. Just try to do all your things in there, even try to get your meals in there. Try to get out as less as possible from that room. That way you will contain all what is produced, and as well as everything will kind of stay in and prevent from contaminating other people in your household. If you do that, then you start thinking in 3 different categories. There's the hot zone, the cold zone, and the warm zone. So we'll talk about the 2 extremes, we'll talk in between. So the hot zone is where you are. So the hot zone is where there's the most risk of infection. So that means where the person is, where the person breathed, all those droplets that we were talking, kind of, getting dispersed and kind of falling down on the floor and everything. So that's the hot zone. The cold zone is really remote from there. There's no place that you can get that. And the warm zone is between all of those, meaning that if I'm going into the hot zone, I need to wear full PPE, and we'll talk about the PPE, which stands for personal protective equipment. If I'm going into the hot zone, I need to wear a proper PPE. If I'm in the warm zone, there's a risk because either I transition from a hot zone and I'm coming out of in the warm zone, and I may be still contaminated. Either I'm still wearing my mask, and so my mask could be contaminated. But once I take all this and I use the proper precaution, anything that is past that buffer zone, then it's a cold zone. So nothing over there, if I'm touching, I shouldn't be having to wear gloves and things like that. So for example, at the hospital, patient room will be the hot zone. The in-between room will be like the nursing station, but our break room shouldn't be a hot zone, a warm zone, sorry, it should be a cold zone, because there shouldn't be anything going there. We should wash our hands when we go into that. And so we're fully decontaminated, if you want, from the virus when we go into that zone. So that zone is safe. So that's what it means when it's cold, it's that it's safe. So nobody needs to wear any protection of any sorts. So when you go inside, the precaution we were talking in the prevention is right now droplets. You'll see a little bit different guidelines based on that in um, medical, like Canadian guidelines versus American guidelines. If you can, and if you have some, use N95. But it is right now the only recommendation, and this is what I use at work all the time, where I work with those people and stuff. If I'm going into a room and it's not been aerosolized, that means there's no BiPAP machine going on, there's no oxygenation at high flow, we're not doing an intubation of any sorts, we're not doing any procedure that could, like doing CPR or anything like this, then I don't need to go in there with a big N95 mask. CDC has just brought it down. Initially, they were at N95 for all patients, and they just brought it down to droplets, I think last week, just like the Canadian are doing. And I think because they're running down low on their mask. That said, if you have an N95 mask, first of all, it would be easier to reuse than other masks. And two, because you're at your own home, there's not as good of a ventilation as hospital have. So it could be worthwhile because those bioaerosols that stays in the air could be a little bit more present in your own home than than if you're in the hospital. So maybe an N95 could be good, but the real thing to wear is one, the person that is sick, when you enter the hot zone, have them wear a mask. By them wearing a mask, so let's say you're about to go there at 8 o'clock, maybe around 10 to 8, make them wear their mask. And so it will give a few minutes for that to kind of settle down, those bioaerosols to go down and have decreased that viral loads kind of present in the room. Then you go in, and let's say it's to help them bring them food, help them change their sheets or do anything that you need to do. Full PPE again, don't forget about that. But because they're wearing the mask, it decreases the load that is present right now a few minutes before. 10 to 20 minutes would be good. That's what they recommend. For example, when we don't have a good ventilation, or when we have a good ventilation, before housekeeping can come and clean our rooms, they wait about 20 minutes for everything to kind of shut down. When you clean the whole room, it's a little bit longer, but I think to decrease the load in your own home, that could be good. 10 to 20 minutes before the person you wear your mask, so that way you contain your own stuff. And then you don't need to wear N95, just the homemade mask. It's again is to contain your own production of droplets and bioaerosols that can stays a little bit in the air while the person is coming to help you go over there. If you have to get out, so let's say you do live in one bedroom apartment or something, somebody has to come and take care of yourself. Clean everything, have your own dishes separately. Any hard surface needs to be clean. And when you clean things, you have to use certain products because not everything killed the virus. Has to at least have 60% of alcohol in it. There's a whole list at CDC, and I have some links that I'll put in. So make sure that those are clean. And if you're getting out, now wear your mask. So that way you keep containing all those, and then you don't spread it all around the apartment or the house that you're going. But the best, if you can, is to isolate yourself from the thing. The other thing too is when you go in, to wear the proper PPE. It can, if people don't quite notice, is like when we're talking about like having a shipment of 1 million N95 and gowns and stuff seems like, wow, that could last forever. But you would be surprised how much in one day to take one patient that we go in, because every time we go in we take off those in a regular situation. Now they're starting to reuse them, but we take them out and then we change them and then we put another gown and then we go in and then we put another set, and then at the end of the day that's accumulated a lot of supplies which you may not have, especially in a limited situation. So what I may recommend is that you reuse those supplies, but, and that's a big but, if you're going to go that route, you have to be very, 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 very careful about your doffing. Most people, when they put gear, it's not when they get contaminated, it's when they take it off. Because one thing they'll do, for example, like I said in the first video, is that they'll take their mask like this, not the proper way, which is basically to take it this way. And you cannot shake that because again it will aerosize, so you have to be very careful when you deposit. If I would be reusing this, and maybe at that stage, if I have mask, I wouldn't be using cotton mask for the person going in that is not sick. For the person that is sick, that would be okay, but the person going in, I wouldn't recommend mask, because this is why they say in the hospital they don't recommend using those, because I mean that person could still get. I would get a very, very good face shield, full face, and maybe like one of those helmet that you could clean to protect you from any droplets. But even that, I would try to keep my good mask. So if you have one N95, or if you have a good surgical mask, or a few surgical masks, I would reuse those ones instead of using the cotton ones, and keep the cotton ones for the person that is actual sick, that she puts on before you go in. So if you're going to reuse your PPE, make sure that when you take them off, so for example, let's say I use one thing that you can use, for example, and when we say full PPE, we call droplets contact. So it's not just droplets. So that means it's not just the mask, it's not just the face, it's contact as well. So that means I'm supposed to wear a full gown, gloves, and face mask, because again those droplets can go all into the air and drops on my clothes or anything that I'm wearing. So I have to be careful about how protected I am. So one of those things that you could carry a few of them and maybe reuse is those dollar store kind of poncho. But again, make sure that the poncho has arms, because if you're getting into your arms, that's no use. But there's some of them that you can kind of use. And so if I would use the poncho idea, would be to remove it. So now this would be clean, and maybe put like a collar tape. So for example, green on the good part and red on the bad part, so that I know, let's say I leave this at the door. If I'm going to reuse this, I have to be careful not to touch the red, which would be on the inside now. And so when I would re-put that in, I would have to be careful not to put my hands on the red, which would be this part, because this is all contaminated. This is hot zone. So when you take it off, make sure that you don't touch the red zone, which would be the hot zone inside, and then the inside would be has to stay clean. So I would have to be careful when you're doing this. The other solution too would be, for example, to use a kind of rain jacket, like those old fisherman rain jacket, and they're fully kind of waterproof and you could clean them when you're getting out. But again, make sure that when you get them out, you don't touch the outside, and you use proper donning and doffing, especially for doffing. There's also a bucket that you could do, leaving at the bedside or outside the door, so that anything that goes in or out of that, especially out, to be able to go into the green zone, has to be clean. And I put a solution that you can have. And so basically it would be a bucket. And the advantage of the bucket versus using wipes all the time is that you could use rags that you leave inside the bucket. Take the rags, you clean it, and then you throw that, because now this rag is dirty. You throw it in another bucket, clean it in the uh, in the washing machine. But the buckets, the solution can is be good to 24 to 48 hours, depending what you do. And so what that means is that with about 6 rag, you could have, let's say, 3 that you can clean everything that goes in and out for that day, 3 that's getting clean, and then you're able to rotate, and then you rotate your liquid every 40 hours or 24 hours, depending on the recipe that you choose and things. Um, but that's to be sure that you don't contaminate the rest of your household, to make sure that you don't contaminate the warm zone, so that way nobody comes to the warm zone not wearing proper PPE and then gets into the cold zone, and now suddenly you have a spread all through the house. So that's not what you want. For the monitoring, because like I was saying, let's say at day 5 you get swabbed and they say, yeah, you're fine, go home and everything. You could still monitor your own symptoms, because how do I know if I'm getting worse? The doctor told me, like, stay home. And especially, I know in the States, going to the emergency can be an expensive visit, so you don't want to go there all the time. A small little device that you could buy, and I'm pretty sure there still is, an oxymeter. And this is the same stuff that they kind of use in the hospital, and they're pretty cheap to buy. And I put that now in my first aid kits because of a situation like this. They can kind of give you a number that can help your decisions. So what it does is that it throws a little light in your fingers, and then what it does is that it gives you a percentage. So 100% is you got better. It's like when you were in school. 100% is when you're doing good in your test. Anything below that, you're starting to be a little bit worse. So what it does is that it reflects a little red light on your red blood cells when they pass, and see how much capacity of oxygen it has. Lower your number, worse you are. And so so if I'm feeling really short of breath and worst symptom that I have, and I put this and I'm at 88% and 89%, that means I would go to the emergency. If I'm between 90, 93%, 94%, anything below 94%, I would kind of go to the emergency. But if I'm between 94 to 100%, I would, monitor it. But that, you see, it could kind of gives you a tool of making a decision: is my symptoms worse, or are they? I just need to monitor them a little bit more closely. Obviously, if you have any suspicion, go back to the emergency so they can do a proper assessment. Because with this, is that a lot of people can, when they go downhill pretty quick, and so you have to get treatment rapidly. But a little device like this, I think they're sold for about $50, depending which one you buy and stuff. And they're great for the first aid kit. Like I said, you see, it doesn't take any space, and I carry them in my first aid kit now because it kind of gives me an idea of oxygen and heart rate, and especially if you're doing transport people, kind of help you with that as well. Otherwise, the same things that we always do when you have like influenza, drinking a lot, taking your medication, a lot of rest, and trying to stay away from non-sick people to not propagate it. On that as well, if you're in a room and you think, oh, I'm going to open the windows to try to ventilate the room, don't forget that wind goes, like if the wind is pushing this way, make sure that the door is well closed. So let's say you're in a room and the room behind you is well closed and almost like something on the ground as well, because you don't want the air circulating pushing all those droplets and all that bioaerosols outside in the warm zone, and that becomes a hot zone. So make sure that your door is closed. The best way would be, if you have a room, is what we call an empty room. So an empty room is basically a place where you do a transition. So basically, I have my room that is closed and it has a door, and then before that, there's another door. So when I get in there, I clean myself and everything. It's the warm zone, so I'm getting clean and stuff. But I'm aware that I could be in a place where contamination could happen. And what it does too is that when I open the other door of somebody that has airborne or somebody that has droplet, is that that stuff doesn't get into the the cold zone, so it stays inside there. And so having like a little plastic in between your door if you want to open the windows and stuff could be a good thing. And those curtains you can buy again at the dollar store and kind of put them just in front of your door, and make sure that whoever passed through that has this inside. I put a bunch of link as well for helping things that CDC have put together or other videos that I saw that was interesting. Hopefully that will help you. If you have any questions, don't hesitate, and I'll talk to you soon.